Cameron Love, and I'm the President and CEO of the Ottawa Hospital, and I really want to thank all of you for joining us here today. The Ottawa Hospital acknowledges that it is located upon the traditional and unceded territory of the Algonquin people. We have the privilege and responsibility to serve First Nations, Métis, and Inuit of many backgrounds and from many treaty lands, and to demonstrate respect for Indigenous peoples' contributions and culture. We also acknowledge traditional knowledge and healing developed through countless generations. I would also like to take a minute to welcome and thank Minister Duclos and the other representatives here today as we celebrate and support patient education, patient engagement and research. As many of you know, the Ottawa Hospital's vision and mission encompasses a continued focus on patient experience and patient-centered care. It is core to being a leading academic health science centre and advancing the care provided by our programs, services, and organization. Patients and families have and continue to be a driving force behind everything we do, whether it's providing direct patient care today or finding new and innovative ways to provide care tomorrow. Everything we do with the patient in mind. However, none of this journey would be possible without the help of dedicated patient and family advisors and partners. They are critical to helping our staff, physicians, and researchers see things from a patient's perspective. This perspective is not just vital to the care we provide, but it's absolutely critical to the research we do. I want to thank all of the patient and family partners that are here with us today. Thank you for your time, your thoughtfulness, and your dedication to improving care for patients today and definitely in the future. There is no question this is an exciting day for the future of patient engagement, and I really want to again thank Minister Duclos and the federal government and both the federal and the provincial governments for making today possible and for this critical investment in the future of healthcare. It is now my pleasure to introduce Dr. Duncan Stewart, our Executive Vice President of Research at the Ottawa Hospital. Thank you.
Thank you, Cameron. Merci. I'm delighted that we can host this announcement today because patient engagement is so important to everything we do. Over the last decade, we've built a world-leading patient and family engagement program at the Ottawa Hospital, and more recently, we've launched what we call OPERA, or the Office of Patient Engagement in Research Activity, which is the first centre of its kind in Canada. Through these two complementary programs, we are engaging hundreds of patients and family partners in more than 70 research projects at the Ottawa Hospital. Nos patients consoliers aidant à chaque étage de la recherche, qui inclut définir les questions de la recherche, choisir quelles données à recueillir, analyser les résultats de recherche et transmettre les résultats à la collectivité. Engaging patients in this way maximizes the impact of research and ensures that research can be optimally applied to improve health. I sincerely thank the federal and provincial governments for supporting this work. I would also like to thank our patient partners, researchers, and supporters who are here today, both in person and virtually. C'est maintenant mon grand plaisir d'introduire la ministre Mona Fortier, présidente du Conseil de Trésor du gouvernement du Canada et députée d'Ottawa-Vanier.
Bon matin tout le monde. Good morning. I'm sure you can answer that question. Bon matin tout le monde. Good morning. What a sunny day here in Ottawa, and I would like to start by just wishing everyone celebrating Diwali a happy Diwali today. And also, just to remind everyone, in Ottawa, it's Decision Day, encouraging everyone to go out and vote. It's a very important election that we have, and I hope, j'espère que vous allez tous prendre le temps d'aller voter aujourd'hui. Alors, très heureuse d'être ici et contente de voir des gens qui sont en ligne avec nous aujourd'hui. Donc, je vous salue également. Et quelle belle journée, comme j'ai dit, d'être ici en si grand nombre. Et avant que je continue, before I continue, I would like to acknowledge also that I am speaking to you from the traditional unceded territory of the Algonquin Anishinaabe people. I'm very pleased to join my friend and colleague, the Health Minister, Jean-Yves Duclos, for today's announcement, and also recognize my colleague, Yassir Naqvi, Member of Parliament for Ottawa Centre, who's joining me today. And of course, thank you to Cameron Love and Duncan Stewart for the warm welcome. Vous savez, à titre de député d'Ottawa-Vanish, je sais quelle place importante l'hôpital d'Ottawa occupe dans la vie des gens de la communauté, de la région, de la capitale nationale. Et si vous me permettez une petite anecdote, j'ai eu le privilège d'être la première présidente de l'Institut du savoir de l'hôpital Montfort et je sais à quel point la recherche est critique, ici dans la région et partout au pays. Alors, je suis très heureuse de faire partie de cette annonce aujourd'hui. Les médecins, le personnel infirmier et tous les professionnels de la santé en milieu hospitalier et communautaire soignent leurs patients avec grande expertise et compassion, tout en étant à l'écoute de leurs proches. Et sur ce point, je tiens à vous remercier tous pour ce que vous faites et ce que vous avez fait. On sait très bien que les 2 dernières années ont été difficiles et nous reconnaissons le rôle critique que vous avez dû relever et que vous continuez à relever. Vous êtes les véritables héros de notre communauté. De plus, les scientifiques et les chercheurs mettent à profit leur intelligence et leur créativité sans bornes dans leur recherche de nouveaux traitements contre des maladies graves. And today's announcement will highlight the value of engaging patients as partner in research. So important. I got a privilege of meeting some of you today. I'm really glad we'll hear from you also today. And here at the Ottawa Hospital, we have a shining example, as I said, of how to bring researchers and patients together successfully to improve health care. Now, to everyone at the Ottawa Hospital, on behalf of myself, Minister Duclos, and our government, thank you for everything you do to promote health in our community and create a healthier future for Canadians. Now, with this, I would like to introduce and invite my colleague, le Ministre Duclos, to come forward to make today's very important announcement. Merci.
Merci beaucoup, Mona. Good morning, everyone. Thank you for being here today on this wonderful sunny day, both outside and inside, I would add, looking at all the bright lights that I see in your eyes. Thank you, Mr. Love, Dr. Stewart, for your warm welcome. Obviously, thank you for the hard work of all of your team. Yes, let's acknowledge that we are today on the traditional unceded territory of the Algonquin Anishinaabe people. Thank you, Yassir, for being with us this morning. Your role is very important in the Ottawa region, and as Member of Parliament of Ottawa Centre, you're obviously central in many different ways to the way we work together. Permettez-moi de commencer par exprimer ma sincère gratitude envers l'équipe de direction de l'hôpital et son personnel pour tous les efforts déployés afin d'obtenir, comme le disait Mona, les meilleurs soins possibles aux patients de la région de la capitale nationale. Je tiens également à souligner la présence du Dr Ferguson, le responsable scientifique de l'Institut de recherche de l'hôpital d'Ottawa, et de Maureen Smith, Madame Smith, bonjour Madame Smith, patiente partenaire de l'unité de soutien de l'Ontario. La Dr Srinivasan et beaucoup d'autres, Dr Srinivasan qui est directrice générale du Centre de coordination de Toronto pour l'unité de soutien de l'Ontario, sont présents avec d'autres avec nous virtuellement. Nous sommes donc rassemblés aujourd'hui pour parler des soins de santé centrés sur la personne et centrés sur les patients, plutôt que sur les outils et sur les systèmes qui font typiquement l'objet de discussions entre les experts de la santé. Pour s'assurer que les priorités des patients ont une place centrale, il faut d'abord s'assurer que ces patients puissent participer activement au processus de recherche. Through the Strategy for Patient-Oriented Research, or SPOR, we have been collaborating with provinces and territories to engage patients as partners in research. As active patients who guide the research process, patients provide a critical and important perspective and help strengthen our healthcare system. This pan-Canadian strategy is led federally by the Canadian Institute of Health Research. A key component of the strategy are support units, which provide specialized services to researchers, patients, clinicians, and policymakers to help them conduct patient-oriented research. While these support units are found across the country, today we focus on our attention on the support units in Ontario. This unit consists of 14 research centres located throughout the province. Since it was established, the Ontario Support has delivered initiatives that have had a tangible impact on the health outcomes and healthcare experiences of patients. And let me take just a moment to speak away from my notes and mention to everyone just around the corner, and just a few minutes ago, we had the opportunity of speaking directly with both researchers and patients, and hearing them about the importance, for instance, of pre-operative interventions. Now, thinking of the way in which physical and mental stress prior to operations can be brought down through significant and meaningful interventions and contributions of patients, including from junior seniors that we just met a moment ago. Also, clinical trials. We know how important these trials have been during COVID-19. Now, just around us, there is pre-clinical trial work to expedite and facilitate the participation of patients in these absolutely essential clinical trials. I've never been a clinical trial participant, but I can easily imagine, and I think all of us can, the stress, the level of concern that may be felt by the patient himself or herself, but also by the families and friends around the patient. But that stress needs to be addressed, acknowledged, addressed, and mitigated as people enter those essential clinical trials. Now, if we need to produce new vaccines, new treatments, to improve various treatments and procedures which have a direct impact on the health of people, we need patients to participate in those clinical trials. These are key elements of strong and rigorous scientific research, and therefore important impacts on the health and healthcare of people. So congratulations for having done all of that. We know there are many different outcomes that could have been signaled also this morning. Now, as we look to the future, the benefits of engaging patients in research remain very clear. And it's critical that we continue to support patient-oriented research in this country. That's why we are therefore so pleased to announce that we are providing new funding to the Ontario Support Unit with a combined investment of $68 million over 5 years through the Canadian Institute of Health Research, the Ontario government and provincial partners. Nous continuons d'appuyer l'unité de soutien de l'Ontario grâce à un financement totalisant 68 millions de dollars au cours des 5 prochaines années, lui permettant ainsi d'entreprendre la prochaine étape de son important travail. En conclusion, donc, nous tenons à remercier toute l'équipe de l'unité de soutien pour ses nombreuses réalisations jusqu'à maintenant. C'est en continuant de travailler ensemble que nous pourrons avoir un impact réel et positif sur la vie des patients et contribuerons par conséquent à bâtir un meilleur système de santé pour les Ontariens et les Ontariennes. Thank you. Merci beaucoup.
So merci, Minister Duclos and Minister Fortier. Thank you to our provincial partners as well for this generous grant. I would now like to introduce Dr. Dean Ferguson. He's the scientific lead for OSSU, which is the Ontario SPOR Support Unit. Dean Ferguson is also a senior scientist at the Ottawa Hospital and director of the Clinical Epidemiology Program and founder of the Ottawa Methods Centre and the architect for our strategy for engaging patients in research here at OHRI. Dean.
Thank you, Dr. Stewart. Good morning. Bonjour. On behalf of OSSU and its 14 research centres across the province, its initiatives, and its coordinating centre in Toronto, I'd like to simply state this is a great day for patient-oriented research in Ontario. It's a great day because of Minister Duclos' announcement that allows us to continue our work, but it's also a great day to recognize and celebrate all the wonderful patient-oriented research that's going on in the province, our collective efforts and impact over the last 8 years. Since our inception in 2014, OSSU has worked hard to engage, to build, and to nurture patient-oriented research across our centres and initiatives. We have made great strides toward achieving this mandate by bringing patients and health system stakeholders together and directly connecting them with policy and decision makers to deliver highly relevant, patient-centred research to improve health care, health equity, patient outcomes, and patient experience in Ontario. On a local note, as we just saw, you can feel the positive impact of patient-oriented research at the Ottawa Hospital. Without question, there's been a cultural change in the way we conceive, conduct, and disseminate research, and we are fortunate that some of our local research is on display today, and it was a real privilege to take the ministers through give a snapshot of all the patient-oriented research that's going on just here at the Ottawa Hospital. And across our campus at the Ontario Child Health Support Unit, which is co-led by CHEO, the Children's Hospital of Eastern Ontario, as well as Sick Kids, they have established dynamic programs themselves in terms of engaging patients and their families in research. And those dynamic programs are available all across Ontario. And their methods team over at OSSU has helped develop and design over 100 patient-oriented projects, have over 100 active patient-oriented projects. Our success at OSSU can also be measured in the number of successful provincial and national grants our patient-oriented researchers have received, along with the impressive number of publications in prestigious journals such as the CMAJ, The Lancet, and New England Journal of Medicine, in areas such as the timing of hip fracture surgery, First Nations diabetic care, and synthesizing COVID-19 evidence during the pandemic. Importantly, with patient partners, we've also advanced the art and science of patient engagement and patient and family engagement by publishing on best methods, practices, and models. And collectively, thanks to the National SPOR Initiative, Ontario has become an international leader in patient-oriented research. Moving forward, OSSU will continue to champion and strengthen patient-oriented research through our 4 dedicated pillars of building and maintaining data platforms, supporting patient engagement, enhancing capacity development to undertake patient-oriented research, and fostering learning health systems. We will also continue our major cross-cutting initiatives across the province, including equity, diversity, inclusion, Francophone communities research, and First Nations, Inuit, and Métis health research. Of course, all this work would not be possible without the support from the Canadian Institutes of Health Research for Health Research SPOR program and our funding partners. On behalf of OSSU, we look forward to building upon our patient-oriented research infrastructure and culture to improve the health and health system for all Ontarians. And now it is my privilege to introduce Ms. Maureen Smith, a patient partner who has made tremendous contributions to patient-oriented research in the province and beyond. Among many roles, Maureen is chair of our Patient Partner Working Group at OSSU and a member of its board of directors. Maureen.
Ministre Duclos, Ministre Fortier, Monsieur Navke, Mr. Love, Dr. Stewart, Ferguson, patients partenaires et tous les gens qui se joignent à nous virtuellement, incluant la directrice exécutive de l'unité de soutien de l'Ontario, Dr. Srinivasan. C'est avec grand plaisir que je viens ici aujourd'hui partager quelques mots avec vous sur l'importance de cette annonce de financement. Every patient and caregiver who is in attendance here in person and virtually, or who engages as a patient partner, has a compelling story to tell. Health journeys with chronic diseases, cancer, parents of children with complex care needs, to name a few, or my own experience as a frequent healthcare user as a result of a childhood diagnosis with a rare disease. As an engaged patient for over 20 years now, I've witnessed the tremendous strides that have been made since the Canadian Institute of Health Research launched the Strategy for Patient-Oriented Research a little more than 10 years ago. I believe that the turning point was the recognition of the vital element that had traditionally been missing from health research, the voices of the health system's ultimate end users, patients and their caregivers. Patients and caregivers, individually and collectively, bring the expertise that is aptly known as lived experience. As you've heard from the previous speakers, there is no doubt that involving people with lived experience of specific conditions as users of health services and of participants in research has a tremendous impact on research. And we're forging ahead to involve patients as partners in all types of health research and at all stages of the research cycle. There remains much work to be done to ensuring that the diversity of voices and experiences is present, but we are determined to tackle these challenges. So we've heard from researchers about how patient-partnered research has impacted their studies. But what does this announcement actually mean for patients like me? Simply put, it means an awful lot. Investing in patient-partnered research to enable patients to become part of the solution is a much-needed stamp of approval. Your words are backed by capacity-building initiatives and a research infrastructure that is continually striving to embed diverse patient perspectives. We want to give back. We want to make it better for the people who come after us and see our insights contribute to health research that meets our needs. It seems even more relevant that we face the pandemic health challenges and this uncertain future together, with patients as collaborators in improving patient care through research. Ministre Duclos, le lancement de la deuxième phase de la stratégie de recherche axée sur le patient et votre engagement à cette initiative de haute importance permet à des gens comme moi de faire partie de la solution. Merci.
Thank you, Maureen, for sharing your story and contributing so much to research at the Ottawa Hospital, at OSSU, and frankly around the world. So it is now my pleasure to turn things over to Ms. Emiliana Titarenko, who will moderate questions if there are any questions from the audience. So, okay, you're there? Okay, you're moderator from the back. Okay, perfect.
Can you hear me? OK. On va maintenant commencer la période de questions. S'il y a des questions dans la salle, on peut utiliser le micro ici. Puis ensuite, on va tourner vers les questions virtuelles. So we will now start the question period. If there's questions, please come forward to this mic here. And then we will turn over to the virtual questions with the reporters joining us on the Zoom. Merci.
I'm Mr. Duclos, Mackenzie Gray with CTV. The Canadian Medical Association has come out and wondered why your government has not fulfilled the promise that you made during the election to transfer $4.5 billion to the provinces for mental health care. What has taken so long to get that money out the door?
Thank you for the question, and maybe I should take this opportunity to thank and congratulate Dr. Lafontaine for his leadership, obviously, but leadership based on the leadership of others that were before him. The CMA and many others have helped us over the last few months recognize the terrible crisis that the healthcare system in our country is going through. And that's because we are going through a healthcare workers crisis. Now, that crisis is driven, obviously, by much of what has been happening during the last 2 years and a half, with a large number of healthcare professionals here in Ottawa and in Ontario and across Canada having left the profession or being sick or being absent or thinking about leaving the profession. Just in Ontario, approximately 15% of nurses are considering leaving the profession in the next year, in addition to all of the others that have left in the recent while. That obviously has been exacerbated by COVID-19, but the pressures were there before, and the pressures will continue thereafter, because we're entering into a world in which aging of the population, including aging of the healthcare workforce, are putting heavy pressure on this type of setting and other settings like long-term care homes. We were discussing that just briefly before the meeting. So that's why we have promised, and we will be investing in the support of provinces and territories to address that healthcare worker crisis, including the mental health crisis that workers do feel. Now, nurses and personal service workers and physicians now just find it extremely hard, to go home at night feeling satisfied with the services that they were able to provide during the day, because there is not enough time and not enough resources for them to do their work, and therefore has an impact on their mental health, but including the mental health of Canadians overall. Approximately 50% of Canadians declare that their mental health now is worse than it was prior to COVID-19. So we've promised we would do more, but we have done quite a lot over the last few months and years. Let's remember this additional $3 billion in mental health that we have promised for the next 5 years. We're currently negotiating that with provinces and territories. We have announced a $200 million well-being network for services in mental health for all Canadians, including healthcare workers. So we know there is more to do. Minister Bennett, my colleague, is obviously very mindful of that, and will be doing more.
So you've outlined the promises you've already made, but as you know, one of the only things the premiers across the country agree on is that you need to give them unilateral health transfers to get them make the decisions with the healthcare system in each province. We've heard from Chrystia Freeland over the last week saying we have tough economic times coming ahead. Is that a signal to the provinces that the current promises that you have on the table for healthcare is it, and that they should not expect any additional unilateral healthcare transfers on top of what you already give?
Great question. Two answers to that question. First on the substance, second on the resources. First on the substance. I'm going to meet my health minister's colleagues in Vancouver in about 3 weeks from now. We've been meeting about a month ago. We've been meeting in many other occasions earlier. Our officials are obviously working together very much. We're working especially on addressing, not only, but for the next meeting in November, especially on addressing the healthcare workers crisis and addressing the problem of accessing family health teams. About 6 million Canadians still don't have access to a family health team, and therefore end up in an emergency room, in a hospital, in other places where they are not given the appropriate care at the appropriate time. And it obviously comes with all sorts of other pressures on the healthcare system. So that's in the substance. Our job, health ministers, is to provide the substance, the means, the resources, and the results that need then to be channeled to the finance officials, the finance ministers, and the Prime Minister and the premiers. But before they can make decisions on the resources and the means, we need to agree on what the results will be and what the means to achieving those results have to be. Always in a manner of respecting jurisdictions of provinces and territories. The federal government should never claim and never suggest that it's best at managing hospitals in Canada. Now, having said so, let me point to the dollars. The Prime Minister has been very clear. There will be more dollars, but there have already been significant investments over the last 3 months. $2 billion that are being now spent to try to catch up on the backlogs of surgeries and diagnostics. Another $1 billion to make sure that our long-term care homes are safer and healthier both for workers and patients. The Canada Health Care Transfer is going to increase by 10% in March 2023, in addition to the fact that it increased by an additional 5% just a few months ago. I won't mention, obviously, the $73 billion of COVID-19 related investments, which still have an impact now because we're still in COVID. So vaccines, Paxlovid, rapid tests that we find at pharmacies, all of these are provided by the federal government because we know that to live with COVID-19 means living responsibly with COVID-19. That has a severe impact on the health of, obviously, patients impacted by COVID-19, the healthcare workers that are themselves quite sick with COVID-19, the fact that they find it very hard to catch up with the backlogs with surgeries and diagnostics, given the heavier load that they need to incur because of COVID-19, knowing that there is a flu season that is coming. And we know it's coming. It's been very hard in the southern hemisphere with the fact that our pediatric hospitals are full with children, with having caught viruses of all sorts over the last few weeks. So this is a crisis that is exacerbated by COVID-19. So keeping the fight against COVID-19, including getting everyone in this room and many others listening to us, being up to date with their vaccination. That's the minimum we should all do to support our healthcare workers and therefore our healthcare system.
OK. S'il n'y a pas de questions dans la chambre, on va tourner vers... oh, excuse. Sorry.
Standing behind you. You're not a teacher who sees behind their head. Hi, Minister. It's lovely to hear the announcement. I'm a patient partner here at the Ottawa Hospital. I'm a high-end user of the hospital, and I walk because of surgeries I've had here, many of them. And I'm also involved at the provincial level. One of the aspects of patient engagement, so I want to bring this focus back to today of patient engagement, is the engagement of patients not only in research, but in policy, setting strategic directions, accreditation, and evaluation. My question for today is, what is the role of patient partners in setting strategic directions at the federal level for the Ministry of Health? In Ontario, we have patient advisory councils for both the Ontario Health, the operational side of the ministry, and the Ministry of Health itself. So what is the parallel? I did write a question to the minister along with my member of parliament, but it was just before COVID and no one expected an answer at that time. But today's my chance. So do you have a patient partner table that advises you?
Excellent question. And we're very grateful to you for asking it. We heard just recently Maureen speaking about her own experience. I used to be a researcher too, an academic, and unfortunately not in life sciences, but in social sciences. I used to be an economist, and as researchers, we're all very excited about producing high-quality work, publishing in great scientific journals, going to conferences, supervising graduate students. This is very exciting, but at the end, we all know that this is useful and meaningful because it helps improve the lives of people. Economics, obviously, economic matters, but for health and life sciences, it's the health of people that is really the outcome, the result, the reason for which we're working so hard. But for that to be as fruitful as possible, researchers now know, certainly in life sciences, that it's best done with patients around. And the CIHR, the Canadian Institute of Health Research, are very, very mindful of that. They've been making progress over the last few years. They'll need to make more progress over the years to come, because that's the future of the research, the life sciences research, to work intimately with researchers. One example in which that will be done even more is on drugs for rare diseases. Madam Smith spoke to that earlier. We're going to soon launch the Drugs for Rare Diseases strategy. This is a strategy that is going to impact the lives of thousands, tens of thousands of people and their families over the years to come. But those investments will be most impactful if from the start they are driven by the priorities, the insights of patients. Where do we need to invest those resources? Where are the priorities? Then what is the design of the research that needs to be put into place from the start? Then how do we implement that research in practice through the example that we've seen? How do we, as you said, have patients be there all throughout the research process, not only at the beginning and at the end, but throughout the research process? And then the end, yes, because when the research outcomes are known, how do we disseminate those research outcomes? So how do we speak to patients, to their families, to their caregivers, to their loved ones, and help professionals, healthcare professionals, use that research?
Thank you. I'd like to also ask or re-ask, what about patient engagement in the actual strategic setting of the directions of the Ministry of Health federally? Not just in research, which happens in agencies such as the Canadian Institute of Health Research, but also in providing you advice from our perspectives of the several people here. Is there a formal council? Have you considered establishing one? Is there a mechanism for patients and their families and caregivers to play a role in strategic directions?
So let's do two things. First, some of my team members are around, so we'll share with you in particular and anyone else what's already there. But second, more importantly, we'll ask you, based on what you'll see from us, what more you can see that could help us and the Ministry of Finance in particular, Ministry of Health, Finance, you can do that separately, Ministry of Health, do more, because there's almost more, there is always more we can do, and especially in this very important, those very important investments. Thank you for that.
Okay, merci. On va maintenant tourner vers Zoom. So we'll now take questions from the Zoom. I think David is there to take it over.
Yes, I am. Bonjour tout le monde. My name is David Coulomb from CIHR Media Relations. Please indicate in the chat if you want to ask a question. Simplement nous indiquer dans le chat si vous avez une question à poser. Et on a déjà une question. Monsieur le ministre, je vais céder la parole à Madame Teresa Wright from Global News. Teresa?
Hi, thank you. My question, Minister, just picking up on the question about the $4.5 billion mental health transfer that was promised in the election. 65 national health organizations are calling for you to move more immediately forward with this. My question is, why isn't there more urgency to make this transfer happen, given the significant challenges facing the health system right now?
There is indeed a lot of urgency, and that's why, as I mentioned earlier, we are currently investing $3 billion over the next 5 years on mental health alone, and that's why we're negotiating currently that initial $3 billion, which is already in the fiscal framework, as we say, and already available to provinces and territories as we sign those agreements. But the Prime Minister and we have been very clear in the campaign. There'll be more. And that's why Minister Bennett is also working with her colleagues to make sure that we know not only where the priorities are, what the results should be, what the means to achieve those results should be, and therefore have access to those means and those resources to achieve the results that we all want to support collaboratively. Collaboratively because, as I mentioned also earlier, this is obviously a provincial territorial jurisdiction. It's always with great respect that the federal government will want to work with provinces and territories in that field and other healthcare-related fields.
And just as a follow-up, the Chief Medical Health Officer for Ontario has said that rising COVID cases and the approach of winter could further jeopardize the province's healthcare system, which could lead the province to have to reintroduce mask mandates. Is the federal government considering reintroducing any mask mandates or other public health measures, particularly regarding travel, if cases continue, again, as a way to prevent the health system from becoming overwhelmed?
Thank you. Three things here. First, as we will have known, the COVID-19 has been very bad for lots of Canadians. It could have been a lot worse had Canadians not done what they needed to do and what they knew they needed to do, which was to protect themselves and others. Just a few weeks ago, PHAC produced a research paper which was published in a journal which showed that had Canadians not followed public health measures or not been vaccinated, there would have been 20 more times more people dying of COVID-19, and therefore millions of Canadians would have been losing a family member or a friend, not mentioning the fact that hospitalizations would have been 15 times larger than what we have seen during COVID-19. So that says that Canadians until now have been very good at acknowledging and meeting and following the public health measures, and we'll need to continue doing that because COVID-19 is not over. The second thing is that many of the measures that you point to are provincial and territorial measures, and they have provinces and territories have our full confidence in their ability to integrate and to manage local public health measures according to their local public health conditions. The third thing is that, as we know, the federal government will always do whatever is necessary to protect the safety and the health of Canadians. Protecting the safety of people is the core responsibility of any government, and that will be our core responsibility over time. We don't know what is coming. However, we know that as the Prime Minister said again last week, to reduce the possibility, the likelihood that more measures will need to be put into place, a key thing we can do together is to be up to date in terms of our vaccination. If we haven't had a vaccine, a COVID-19 vaccine in the last 6 months, now is the time to get one. And the good news is that we have an even better vaccine now, a bivalent vaccine, Pfizer and Moderna, than we used to have. And that bivalent vaccine is effective at fighting against Omicron, which is the currently circulating variant of COVID-19.
Nous avons une autre question, Monsieur le Ministre. Elle nous vient de Carmen Jones. Carmen?
Good morning, Minister. I'm Carmen Jones, the Director of Research and Data Management for the Chiefs of Ontario, and also a partner with OSSU in Ontario. I want to thank you, first of all, for acknowledging the First Nations people in the territory that you are at. I also want to mention to you that within the strategy, I noticed that there's not a specific mention of First Nations and the funding that needs to be put into the communities. Is there any sort of strategy or specific funding that would assist First Nation communities in the work that we're doing with our communities? Miigwech.
That's a great question, and for a good answer, I would invite Dr. Ferguson to come to the microphone.
Thank you, Carmen, for that question. As you know, within OSSU and its strategy, a major initiative is to ensure that we have that researchers consider our Indigenous peoples, First Nation, Métis, and Inuit in their research. And we have dedicated, supported some of that with supporting dollars and funding dollars and running projects and demonstration projects that help contribute. So, opening up monies to further that specific research. Good.
Is that okay, Carmen?
Yes, I understand that, but the funding that comes to the First Nations people is not adequate. So I just want to mention that. Miigwech.
And Carmen, if you would like to be in touch with the team, we would be happy to provide any support in connecting CIHR with the appropriate people.
Okay, miigwech.
Okay, Minister, I don't see any more questions. Je ne vois pas d'autres questions. Alors, back to you on site.
Well, thank you everyone for having a great sunny day.
think we'll do a photo with all the speakers, if all the speakers